white coat hypertension is less common than that of white coats are in tension. The scenario has changed. Like if they think that if anything happened to the patient, that is due to the mistake of doctors. So this should not be the criteria. We have seen the latest incidents where the doctors has done suicide because extreme step. So I would like to say, sir, that this point should also be included in this discussion, that white coat hypertension, although it is there, and we are taking care of that because we are committed. We have to take care to the patient. But what is happening in the society, that is also not good. The doctors are also in stress nowadays because of these incidences, and it is very difficult to practice medicine. We want a friendly atmosphere. The patient should not be God. Even if it is whether it is a hypertension, what is the problem, and we tackle accordingly. So if
is really a hypertension patient, suffers from hypertension. But she has also added one more angle in this. She says, why only the white coat syndrome? There are now the cases where the white coat people, they themselves suffer with this anxiety or the syndrome, that if anything goes wrong, the relatives of the patient are going to misbehave with them. And that is also a very big challenge for a doctor to overcome this type of anxiety or the blood pressure or the hypertension. And she says that recently one doctor committed suicide because of the ill behavior of the patient relatives, and that's why she has to commit suicide. So according to her, this is also a phenomenon which is now developing in India. The doctors are always in stress and threat because of the something can happen and no one is there to safeguard them. And so according to her, it is for both, for the patient as well as for the doctors, this white coat syndrome. Thank you very much, Dr. Caru Maheshwari, for giving this new angle also. Yes, this is also nowadays we are seeing, and especially in the COVID also, we have seen how the patients, relatives ill-treated the doctors, which is really very unfortunate. Thank you very much for giving your views. Now, I would like to invite my next panelist guest, and she is Miss Karishma Chhatrapati. Miss Karishma Chhatrapati is the inner transformation coach. She is the founder of the Being Spiritual with KUC. She is knowledgeable partner of Fitsa Private Limited, Mumbai. She started out as a journalist, then progressed to an editorial desk job, and on the side, she completed her master's in psychotherapy and counseling and master's in psychology. For 8 years, she doubled, rather tripled up as an editor, freelance writer, and corporate coach and psychotherapist. Then in 2008, she switched completely to coaching, psychotherapy, and counseling, used a myriad of modalities to help her clients. Her hat has filled with knowledge of tarot, angel card reading, Hindu rites and rituals from a spiritual perspectives, crystal healing, Reiki, guided meditations, mindfulness, hypnotherapy, astrology, rune casting, crystal ball gauging, art therapy, handwriting and signature analysis, candle meditation, etc. Being spiritual with KUC, sorry, she crested community. Her every blog post comes from a space of deeper understanding, wisdom brought about by the awareness that comes through experience of the lessons learned. Welcome, Ms. Karishma Chhatrapati on our show. Ms. Karishma Chhatrapati, you have heard the three doctors, Dr. Nikita Pawar, Dr. Dilip Singhvi, as well as Dr. Caru 𝐂𝐀𝐑𝐔, and they all have given their views how the patient who are entering in a hospital or a clinic or medical setup feels this white coat syndrome. And Dr. Caru 𝐂𝐀𝐑𝐔 although added one more thing, that even the doctors are also suffering from anxiety and sometimes hypertension because of the, if anything goes wrong with a particular difficult patient. Now, being a psychologist and you are seeing this phenomena and you might be coming across with this type of phenomena, we would like to know your views on this white coat syndrome. Ms. Karishma Chhatrapati, please.
Thank you so much, Mr. Lal, for having me here. Good morning to all the other panelists. Dr. Charu, thank you for bringing that up before I go ahead and talking about white coat syndrome. That yes, it is very unfortunate that today people cannot handle their emotions the way they're supposed to, and recognize that being a doctor is a very noble profession. You all serve us really well, and thank you for that. But on that note, I'll only remind you, hurt people hurt people. They come from a place of pain, but it does not justify the ends of their action. Now, coming to today's topic, I'm going to give a psychological perspective to this with my own experience. I am living with type 1 diabetes since over 31 years. Every time I would have to visit my endocrinologist or my other doctors, I would realize that my pulse is beating a little faster. I'm feeling a little anxious. I'm feeling very restless sitting at the doctor's clinic. And I asked myself once, I said, why is this happening? The reason this happens is because when we come to a doctor, we always imagine that the worst is going to be told to us because we see it in media, we see it in the news. There's so much of talk about the big C and other such diseases that we can't even think that a common cold could be as common as it is supposed to be. Because now the big thing is that if it's a cold, is it COVID? Am I going to die from it? We all know we're going to die at some point, but the thought of death is very scary. And when you're sitting at a doctor's clinic, that's the only place where it may just become a reality if that is your diagnosis. So yes, it is a very important aspect which has not been spoken about, which has not been taken into account. However, I will not say that this is only psychological. It can be medical, as my previous panelists explained. From a psychological perspective, what can you do to help yourself when you visit a doctor's clinic? You can't expect the doctor to have this entire setup where it's going to be so comfortable, television sets and all of that. Make yourself comfortable as a patient. When I go to the doctor, I carry a book. If nothing else, I catch up on a podcast, wear my earplugs and I listen to a podcast. I take someone with me with whom I can have a nice, hearty conversation with. We have to find our own ways of dealing with anxiety. Not every visit to a doctor means that it is the end of the world, because you know what? When you get your diagnosis right, you know that there's a possibility for a cure and a better life. So don't look as the doctor as somebody like the judge who's going to put the pen on the paper and say, sorry, you've got only this much of life because you're not well. That's not true. We don't have to fear a doctor who's here to heal us, to cure us. When we recognize this, then the anxiety levels would come down. When are we anxious? What is the syndrome? When we do not know what next. What next based on the reports that we're carrying? What next based on the symptoms that we're suffering from? We don't know. And waiting in that room and watching other people, some coming out happy and relieved, some coming out absolutely dejected, some people upset, your anxiety keeps increasing. What do you need to do under these circumstances? Distract yourself. Mindfulness, breathe, carry an adult coloring book. Have you seen when you go to a pediatrician, is a child suffering from anxiety even if that child is not well? No, because that child is so distracted. So why can't we as adults look at the possibilities from the positivity of what could be rather than what our mind keeps telling us it may be? Anxiety comes from that space of not knowing and thereby going into the negative aspect of, I don't know what's going to happen. What if I'm going to die? And believe me, at a subconscious level, everyone fears that they're going to be told that time is coming up for them. This is the level of anxiety we deal with. Yes, you will have elevated blood pressure levels. Yes, you will have pulse rate running all over the place. All that will happen that then catapulate to look as though it is hypertension. I had that 2 to 3 times, and my endocrinologist would say, Karishma, did you check your blood pressure in the morning? I said, yes. Then why right now is it elevated? What are you stressed out about? And I would tell him what exactly was stressing me out. And that's when I realized that there's a difference. So most doctors that I'm aware of nowadays, recognizing this aspect of white coat syndrome, ask their patients on the day of their visit to check their blood pressure in the morning rather than have them check it in the clinic. I'm not saying this is the right way or the wrong way, and I'm not here to tell the doctors how they need to practice medicine. But sometimes if you know that your patients do suffer from that kind of anxiety, maybe you could work around it to help them. It's a two-way stream, your relationship with your patient. And maybe we must take this conversation much more seriously, as Mr. Lal has done so this morning, so that we can solve the issue rather than have people go all over the place and antagonize our precious doctors out there. For even their doing harm to the doctors comes from a very deep space of anxiety, of fear, of hurt and pain. We can make the society a better place when we can work together and address even the syndromes that seem as minor as a white coat syndrome. That's what I would like to bring into the room today. Mr. Lal, thank you so much for having me here.
Thank you very much, Ms. Karishma Chakrabarti. I can understand that you have had a long flight yesterday from Switzerland to India, and still you have accepted my invitation to join as a guest panelist. This is nice of you. I will definitely come for the question in the next round to just so that our viewers will have more clarity about this white coat syndrome. Now, my question goes to Dr. Dilip Singhvi. Dr. Dilip Singhvi, my questions to you is, are you there, Dr. Dilip Singhvi?
Yeah, I'm here.
Okay. Dr. Dilip Singhvi, when we all know this white coat syndrome, is anything has been done or has been taught in the medical college to reverse this white coat syndrome, or how to overcome on this white coat syndrome? Whether this is in the curriculum of the medical college studies or not? If not, do you suggest that it should also be there in this about this white coat syndrome?
As I said, see, this is a very old entity. It's a syndrome which we all know, and we have been taught in our medical schools about it. The only thing is, when we see as a theory, we know it is there. Now, once a doctor he finishes his training and comes to the clinical practice, this is where we actually experience this, and we find out that the patient has got with whatever various means which we have already discussed with our all eminent panelists have discussed. So once we diagnose a patient that he is having white coat hypertension, again, what happens is we need to differentiate. It is just a stress of coming to the hospital, meeting to the doctor, and as our psychologist, she has beautifully said that sometimes it's just anxiety that they are anticipating some worse news or some bad breaking news is going to happen to them. So that fear itself starts the BP to rise. Maybe sometimes, as I said earlier, it's the thought at home that I'm going to visit the doctor today drives the BP up. So now, is it an isolated phenomenon of white coat syndrome, or the patient has a personality towards anxiety? So we need to dig into the history. We need to sit with the patient. We need to talk to them. We need to address this aspect of stress and anxiety, which is driving why it is happening. And if we can, actually what is happening is that all of us are in a rush now. Everybody, and especially in country like India, where such a big, huge population has to be dealt with, and the number of doctors are always short. Everybody is in a big hurry. we as practicing doctors do not get that much of time to negotiate all this. So that is where we need help from our other colleagues like psychiatrists or sociologists or other health workers who can sit with these patients. We can always diagnose it and maybe try to find out the cause also, the etiology, why it is happening. Maybe the patient might be having some sort of other personal problems which is causing the stress apart from the doctor visit itself. So this differentiation is also very important. That's why I said that the counseling should be patient centric, and there should not be a lack of enthusiasm or inertia from both sides. If the doctor can find out the cause, why the patient is getting stressed, then accordingly we can counsel the patient. If it is just a fear of bad breaking news or a bad or something, some patients, they just have a feeling कि मेरे साथ आज कुछ बुरा होने वाला है, something bad is going to happen with me. It could be the end of my life, it could be the end of the world, or the doctor is going to tell me very bad news. Is it simply that? Even if it is that, supposing, and there are ways of dealing it, there is ways of how we break a bad news to the patient. We can make them relax first, we can offer them water, we can offer them tissues, we can offer them help with their family members who have come with them. We can even make the patient wait and sit and calm down when she is or he is ready to talk to me. So there are various techniques to deal with this. But what is more important is to identify whether this is an isolated event only for a doctor or a hospital or a visit, or there are different issues going with the patient's life which also is causing anxiety. Or sometimes what happens, some patients, few people have anxious personality, not only doctor visit, even a small thing coming up in life, whether it is an exam, whether it is an interview, whether it is whatever the reason is, they become too anxious. They start to have tremors, palpitations, and so on and so forth. So this history has to be digged in. Once you get these facts out, then obviously we can use various techniques and ways to counsel the patient. Of course, patient participation is also very important, because it is very easy to say that you have this, and you need to do this, but it is very difficult to follow for the patient also. So I would say it is a team approach. It is not just a physician or a doctor who is involved. It's a teamwork. There are so many people needed for it. So many inputs are needed. We need our supporting staff, our nursing staff, our other health workers, our psychiatrists, our sociologists. It's a teamwork. But yes, the primary role is with us to diagnose the patient that it is white coat. If you have the time in the clinic, please do it. Make the patient aware that it's a simple entity. There is nothing to be worried about it. It can be taken care of. We have various ways of dealing it, whether it is lifestyle, non-pharmacological or pharmacological. And the most important reassurance the doctor should give to the patient is that we are with them throughout their journey, and we work for the best interest of the patient. And as our my panelist, Dr. Charu, has very well highlighted, yes, I mean, I would say, since I am working out of India, and I've been seeing also these incidences are happening more often in India. I don't know why the people are having so much of unrest, why the people are having so less threshold for agitation and protest and hitting. Rest of the world, you hardly find any incidences. Maybe a one stray incident somewhere, but normally these incidences do not happen. So, but in India it happens. I don't know. There's a big communication gap both sides, either from the doctor's side or from the patient side, because what we have been taught in medical school and how we practice is that it is always in the best interest of the patient. Every doctor works for the best interest of the patient. We want our patients to go happily from the hospital, not crying. They come to us in pain, but it is our responsibility, it is our duty which we perform to save them, to make them happy, and ensure that they leave the hospital with a smile. But after all, we are also humans. We have our limitations. We are not gods. So there are certain things which is beyond us, and that has to be communicated to the patient that, see, there is a point beyond which we cannot do anything. This counseling might be needed, should be done by all doctors. People should address this communication gap is there. And I would request you, Mr. Lal, you should do a show on this also, on this topic. It's a very important topic. We can always discuss on this. So and as well as on stress. This is also an important, how to reduce stress in community. So these are very two important aspects which affects everybody in the society, including doctors. Every professional is being affected by this stress. It is the biggest silent killer, I would say, which drives all these entities, whether it is white coat hypertension, essential hypertension, secondary hypertension, whatever it is. The first thing which drives the BP up is the stress.
Okay.
So I am always open for these two topics also. But yes, we need to diagnose. We need to make the society aware of this entity. Tell them this is a benign entity. It is very innocent. It is not dangerous. We can tackle it together, and we are always there to help you.
Okay, thank you very much. Thank you very much, Dr. Dilip Singh, for giving your views and very, very clear views. And I'm sure that the viewers who are watching our show should understand that unnecessary taking the anxiety is not required. It will affect their health, and it will be, it's best that they can talk to the doctor in a comfort zone and tell them that this anxiety is there. So doctor can definitely pacify them and explain to them there's nothing to worry. After all, whether it's a good news or bad news, one has to face it boldly. Thank you very much, Dr. Singhvi. Now my question goes to Dr. Nikita Pawar. Dr. Nikita Pawar, we are talking about white coat syndrome. What about black coat syndrome? You being a daughter of a very leading advocate, and you know that when the client or those whether he's accused or he's a prosecutor, when he goes to the court, he or she also have the same anxiety. What is going to be the judgment? So why we only talk about the white coat syndrome? Why we only say why not it can be black coat syndrome when the clients are going to the court and they have the same thing? And similarly, as Dr. Singhvi mentioned about the interview or the examination. So it is a common thing, a person who can have developed this thing, and it increases the blood pressure. So my question to you is, first thing is whether it is across the board or only with the hospital. Number two, if it is across the board, then what difference it makes? And at least as a doctor, you know that the patient which is come is having white coat syndrome. So the diagnosis should not be changed because of that increase or decrease of the blood pressure. What you say about this, Dr. Nikita Pawar?
I would like to say that, of course, black coat syndrome is also very prevalent nowadays. And my mom, being a lawyer, she is also seeing that, mostly the people who are coming, they're suffering more from black coat syndrome because there's a judge, there's a verdict about a case. And I think people, lawyers who are practicing in sessions court and, magistrate court, there is a final verdict, the person can be jailed and also from some kind of hypertension, or there might be an hypertension. I feel they should in fact employ doctors as well over there to monitor their BP. Sometimes it may happen that that they might have the chances of developing hypertension because of repeated coming towards the court, because they have dates, so they have to keep coming to the court, so they always keep on being in anxiety. So basically, we have to solve is the anxiety-related problem as well as the worries or any kind of mental pressure which they're having. Even while coming to the hospital setup, also they have to be they have to be relaxed. They have to be counseled. If they are already a patient of anxiousness or any kind of worry, then they should be, of course, going to psychiatric doctor or take psychiatric counseling where they can be medicated, where they can be counseled. Some people have this kind of feeling, that any kind of thing which is there, like examination or any kind of interviews there, they start having anxiousness. So this kind of anxiousness can be also tackled with the help of a counselor or any kind of psychiatric doctor. But yes, I feel that black coat hypertension is more prevalent, in fact, than white coat hypertension. And nowadays, if I, as a researcher, I've been keep on reading a lot of articles. Black coat syndrome is in fact causing a lot of people to suffer from hypertension rather than white coat syndrome, because black coat syndrome, it's a final kind of verdict where your we are waiting for the judgment of the judge. So yes, people do suffer a lot from the black coat syndrome as well. In fact, that is much more important topic than white coat syndrome, because white coat syndrome, of course, the patient knows that, when they're going to the doctor, why the doctor is of course going to medicate them and they're going to get treated. This is what is there on their mind. But black coat syndrome is such a syndrome where, they know that the verdict is going to come, whether it's going to be positive or negative. And if it is negative, it's going to be, of course, going to cause a lot of tension, worry, and anxiety, and this may cause BP. And even if it's positive, also, even in happiness, also BP can increase. This is one issue which is there. And another thing which you have also said is, about hypertension. Why is it not prevalent? I know black coat is not that prevalent and not told about. Yes, nowadays there are a lot of studies, there are a lot of research being done. In fact, if one sees on Google as searches, they have been talking about black coat syndrome as well. That, patients who are having black coat syndrome are more prevalent to have BP. And even it's not only a black coat or white coat. Even in any kind of setup, even if they go to psychiatrist, even if they go to gynecologist, even if they go to gynecologist, even the pregnant women who are going to gynecologist, they have called something called as gestational BP, which is there. That happens only during pregnancy. So it's like, a person has that inbornness of, having anxiety and sometimes depression. So therefore, this kind of hypertension can prevail. They can take place. So what we can do is that when such patients are there and we feel they are in kind, we can see by the pulse oximeter. Like sometimes we see that the pulse rate has gone high. The person is like, that means he's in anxiety. So we have to tell them that, you have to calm yourself, do relaxation methods, do meditation, do yoga, do exercises. So that person is busy and engaged throughout the day and he doesn't have anything to think about negative thoughts, and try to be positive. That's very important, including even if he's going to the court or even if he's going to the doctor, the person has to compulsorily start with his regular exercises, yoga, meditation. And it's very important that the stress factor which is there, that is the main factor which is nowadays causing all kind of diseases, all kind of problems like diabetes, hypertension, heart diseases, any kind of risk factor. So basically, stress is the triggering factor. So to avoid stress, we have to counsel the patients that yes, you have to start with your regular exercises, diet management, healthy lifestyle, and not to take any kind of stress on mind about any kind of things happening in the world. Because if a person starts taking stress, of course, it's going to take a toll on your health. So, and it's basically going to act upon being a hypertensive patient or a diabetic patient. So I feel that natural way methods of using in your lifestyle to maintain a healthy lifestyle, natural methods will always be very good rather than going on allopathic medications, or rather than just going on any care. Get counseled, talk to a counselor, talk to a friend, talk to a person who is positive, who doesn't make you feel negative. And before, of course, I said before going to any kind of place, is it doctor or any kind of setup like court or any kind of psychiatric doctor, please relax your mind, take deep breaths, meditate, and try to take the BP if it's possible. Keep monitoring the BP, even at home also, even at the doctor's place also, so that you always know that what your readings are. And of course, BP is not something like a major disease. It can be controlled as well. So try to control it in a natural way. This is what I want to tell people. Thank you so much, sir.
Thank you very much, Dr. Nikita Pawar. And as you very clearly mentioned about the black coat syndrome also, so one has to understand that it is not only the white coat, it's a black coat, means the courts, cases, etc. So wherever anyone is going where there some result is to be announced, they feel that there will be anxiety factor. Thank you very much. I will come to you in the next round again. Now my question goes to Dr. Caru Maheshwari. Dr. Caru Maheshwari, you mentioned about the doctors also. But do you agree that those few doctors whose behaviors are not good with the patients, might be that they think that this is a very simple thing, and if the patient is not following, they lose their control. They try to be a bit angry or rude with the patient, and that's why the patient feel fearful to go to the doctor, and that's why this white coat syndrome developed. But there are doctors who behave very nicely with the patient, They talk like in a family atmosphere type of thing. And there the BP, do you think that white coat syndrome is having something related to the behavior of the doctor or not? Or if yes, then what difference? Because many doctors who are talking very nicely, very sweetly, and then still whether it is white coat syndrome is there or not, or it is only it's only with those doctors who are talking in a bit rude way or a rough way or a angry way, because it's not the problem of the doctor, but the problem is that the patient is not understanding, not following what instructions the doctors have given. He misses his tablets or injections, so the doctor knows that the disease is increasing because of his carelessness. So he just want to correct him by showing the anger. What do you say about this, Dr. Charu Maheshwari?
Sir, I agree with you. So first of all, I will clear one thing, most important thing, that every doctor is a human being first. And the nature, everyone is having different. All doctors cannot be nice. All doctors cannot be polite. Everyone is different. The way Yogi talks, the way Modi talks is different. Yogi is always aggressive and Modi is always silent. So like that, all doctors are different. But the motive of all the doctors, if they are educated and well versed, not the I'm talking about the jhola chap, their motto is to take care of the patient and give best to them. Sometimes yes, sometimes doctors are rude, maybe sometimes they are having something in their mind, they are having in their mind ki pehle wale patient ki kuch problem thi, some stress is there, maybe family stress is there, because we human beings are always full of emotions. Although doctors, even if they are operating to their sister or any relative, they always want, they will do the best. So that is always there. I know the white coat hypertension, that may be the reason, because it is the name is because of the white coat. Because when the patient is afraid of doctors and his BP rises, so that is, of course, it is a white coat hypertension. But of course, if a doctor find it out that it may be due to my rude behavior, the patient is getting problem, so he will always become nice and he will try to control that situation if it is happening due to. Although all patients, sometimes what happens ki in today what patient says, they will come with a diagnosis from the Google and they will say, no, madam, we are having this problem. So already BP rises. That if you are diagnosing, then you take the treatment also from there. So sometimes I also become rude, that this is not the way. If you are coming to the doctor, everything Google cannot tell. So they are the reason why the doctor is getting high BP or getting rude behavior. So we should also understand that we should first listen to him, what he want to say, and then we should politely put questions to him that, sir, this is like this, but I have heard this thing. Can it be right? So he will clear that situation. That will become more easy. So doctor-patient relationship, it should be good relation so that the both parties will get benefit. Doctor will also will calm and he will give the better treatment.
Okay, thank you very much, Dr. Charu Maheshwari. So according to you, that it's a relationship between the patient and the doctor that is very important, how they treat each other and how they behave with each other. And that's why one of the causes of this white coat hypertension or white coat syndrome. Thank you very much. Now my question goes to Ms. Karishma Chhatrapati. Ms. Karishma Chhatrapati, why we are afraid about this white coat syndrome? Rather, if I will put in another way, it is a good thing, because if a person knows that he's going to a doctor or he's going to a court or he's going anywhere where the news can be plus positive or negative, if he or she is ready to listen that news, definitely somewhat the anxiety will be there, the BP will increase. And once the news is disclosed, that if it is a good news, fine. If it is a bad news, also at that time already the BP has increased. So that there will be no shock. But if someone is going visiting the doctor's clinic or the court or wherever, and the news comes unexpectedly, which he or she is not prepared. The person, if patient is going just as casually, I am just going to the hospital, and then that patient, the doctor disclosed that, so you are suffering with this life-threatening disease. At that time, it was a shock, and once it is a shock, then it can be more disaster. Or do you think no, one should not have any anxiety? Because if you are already you are ready to fight, to hear the news, even a bad news, then you will not suffer any stroke. But if you are not ready and unexpectedly some bad news is disclosed to you, you may even suffer more increase of blood pressure. What you say about this, Ms. Chhatrapati?
Thank you for the very beautiful question, Mr. Lal. It's very insightful to go through that. So why is this known as a white coat syndrome? Anxiety is always regarding something that is unknown and not that which is known. So while a person is going to the doctor, they don't know. They don't know what the doctor is going to say. They don't know what the result is going to be. Once the doctor gives that diagnosis, however good or bad it may be, what you know. Because what then you face after a bad diagnosis or a sad diagnosis is more about the grief and the fear of what to do next. But the anticipation of it is the syndrome that people suffer from while sitting in the doctor's clinic. So there are two aspects. One is the anticipation, which is the anxiety or the white coat syndrome we are addressing today. The next is once the diagnosis has come through. If it's good news, all is well, it's not COVID, it's just a common cold. You go home, you do what you need to. If it's COVID, then you start thinking of what and how. But at least you know. Once you know something, you're not anxious about it anymore. To a certain extent, you are from the perspective of what next, what do I do next? And then the doctor will give you a list of what to do, what not to do, who are the specialists you can visit, etc. So post-diagnosis, it's not so much an anxiety issue, rather a fear and grief issue. Because then you have to process your entire life if it is a bad diagnosis. When I say bad diagnosis, I mean something that is life-threatening. If it is something simple to deal with, you walk out, you're very relieved and you're smiling like many patients do. Now, how can we help people deal with this? I had said this earlier, and thank you for recognizing that I'm also exhausted from my flight, is that when going to a clinic, there's nothing much that a doctor can do to make it more comfortable than it is. It is for us to educate people. Yes, I do believe that in India, we have to say a counselor in a clinic should be a must. So that if anyone is going through anxiety, they can quickly go and talk to the counselor is talking to them. But keeping things in mind, it probably cannot be done. Yet at the same time, what can you do as a patient? Blank yourself out. Sit down. Take a few mindful breaths. Just breathe, breathe, breathe. Breathe out that anxiety. Deep, slow breaths. Listen to a podcast. Everyone has got playlists on their phones nowadays. Take your earplugs and just listen to your favorite music. Watch something on your phone, play a game, read a book, read a magazine. Interact with somebody. Your anxiety levels will go down, because as long as you are anticipating something going against you, your mind will keep wandering, and then your pressure levels will increase. Settle yourself down. This is a mind game that you need to play with yourself. Keep telling yourself, I'm fine. I'm here for the best. My doctor's the best, and he or she is going to do the best for me. You have to keep it down. And post-diagnosis, if you have anxiety, address it with your doctor. Ask the doctor for who all you need to see. Get your education done on whatever your diagnosis is. All will be fine. The doctors are here to heal us and cure us. Surrender to them. Trust them. They know what they're doing for our body. The education has brought them this far.
Okay. Thank you. Thank you very much, Ms. Karishma Chhatrapati, for giving your views. Now, in the last round, I would like to know, Dr. Singhvi, are you there? Dr. Singhvi?
Yeah, I'm here, Mr. Lal.
Yeah. Now, I would like to know from you your advice and suggestions to the doctors as well as to the patients or their relatives about this white coat syndrome?
Yeah, another good question. Well, from the doctor's point of view, as I said, that we should not be in a hurry to treat the patient. One single reading of high BP should not be taken as hypertension. If we diagnose it as white coat, we should negotiate what is it leading, why it is being happening with the patient, why this anxiety, stress, isolated phenomenon versus go into the history and dig in more, whether this is one particular episode with the doctor or there are other things going on in his life. From the patient side, I would say that we all of us, we prepare for any it's a part of life. Any sudden event in the life can cause anxiety. Similarly, any test faced in their life, whether it is a doctor's clinic, whether it is an exam, interview, court case, financial, personal, marital, n number of issues are there going in one person's life. We tend to face it. Either we fight it or we fear it. So I would say, don't fear it, fight it out. And as doctors, we are always with the patients. As I said, we are always ready to help, or we will always advise you how to fight it. Supposing if I'm not the proper person to counsel you, we will always direct you to the proper person who can counsel you, whether it is your family member, whether it is your friend, whether it is a psychiatrist, whether it is a sociologist. We always direct, I mean, at least I always direct my patient where he should seek help if at all he needs a help. Okay. That should usually help the patient. And of course, I would say patient comes to us with trust that the doctor is going to help us. The doctor is going to treat us. The doctor will take care of us, whichever aspect it is. And that promise and faith, that relationship runs on faith and trust. And we should be, as a doctor, be able to maintain this trust with the patient. We should, as you said, a sweet doctor or a happy doctor or a smiling doctor will take half of the disease away from the patient by just smiling and talking politely to them. And very often I get my patients here who say कि आपकी clinic में आके हमारी आधी चिंता दूर हो जाती, and the rest half goes away when you counsel us and you tell us. See, giving the right advice to the patient what he is supposed to do is 50% job done.
Okay.
Even if it is out of your domain, even if it is out of your domain, you know that this patient I cannot treat. But if you direct the patient that yes, you need to go to a psychiatrist, or you need to go to a urologist, or you need to go to an ophthalmologist, this is where you need to go. And if that advice is correct, believe me, that patient will have blind trust on you. He will always return back to you for any problem in the family or with the patient. He will always, I have so many patients whom I'm treating families, and anything will happen in the family, the first thing will come to me. Please, yesterday you won't believe, I got one of my Pakistani patient is there. The whole family comes to me. You won't believe, he has sent me reports of his neonate from Pakistan. Please see and tell me what is in this. Now, I am not a neonatologist, but that neonatologist reports he has sent to me for second opinion. Whether what they are doing is correct or not.
Yes. Okay.
That is the faith and trust.
Yes. Yes.
If you can gain,
yeah, I think you're mute now. Thank you very much, Dr. Singhvi,
for the family.
For your view.
Have a good rapport with the patient, and you will be able to negotiate any problem with the patient.
Okay. Thank you very much, Dr. Dilip Singhvi. Now my question goes to Dr. Nikita Pawar. Dr. Nikita Pawar, one suggestion you want to give to the patient and one suggestion to the medical fraternity. Dr. Nikita Pawar, are you there? I think you're... Yes, please. No, I think your net is... Yeah. No, your net is... Okay, Dr. Caru Maheshwari, one suggestion for the patients and one for the doctors?
One suggestion for the patient, I will say that you need to talk and talk and talk. You make a set of questions which you are going to ask your doctors. Once you will make it, then you will not afraid with the doctor, and talk everything, any doubt you have in your problem, always talk to them. Secondly, to the doctors, I will advise that always listen to their patient. what they are asking, whether it is irrelevant. Sometimes they will talk about their mother-in-law's problems. Sometimes they will talk about other family issues. Just listen to them, because sometimes listening to them, it can also help them to reduce 50% stress.
Oh,
So
okay.
my,
Thank you.
both the parties, I will say that you should have a better doctor-patient relationship, and that can give you better.
Okay, thank you. Dr. Nikita Pawar, one suggestion for patients and one for the doctors.
One suggestion for patients is that whenever they are going to the clinic or any kind of setup, I always would recommend that they should be in relaxed mind, and they should always have faith on doctors that the doctor is going to do the best treatment and going to do the best for us. So he should always have that kind of assurance on his mind. And any kind of facility, if he's going interview or any kind of court also, you should always feel that the person who is going to argue for him also is the best person, and he's going to take out a good outcome out of it.
Okay.
This is what I feel. And as a patient and as a doctor, I feel that doctor should always be calm, and he should always be smiling. Very important, whatever family issues, whatever personal issues he has, because the patient is going to come to you is seeking advice. So we don't have to take out any kind of frustrations on. So a friendliness and friendly attitude by the doctor is very important.
Okay, thank you very much. Ms. Karishma Chhatrapati, your take. One suggestion and for patients and the doctors.
One suggestion, keeping both in mind, because both are human beings first, be empathetic, be good listeners, take the right kind of knowledge whether you're going to the doctor, and get the right kind of knowledge when the patient comes to you. Empathy will make things much better. That's my quick suggestion.
Okay, thank you very much. So viewers, we have seen today this white coat syndrome, which is quite common, happening everywhere in the world, in India also. One should understand that you are going to a doctor, and doctor is not going to harm you. He is there to help you. So why to feel afraid? Or even if you are going anywhere, you have to control yourself. But only thing is, you should also change your behavior. And it's we have seen in our society, for a small children, we always say, you eat this thing, otherwise the injections will be given by the doctor, uncle. Now we create the fear psychosis, the civil society, we parents create the fear psychosis from the very beginning to a child. And that fear psychosis develop this white coat syndrome. So it is always better, never create any negative impression, whether it is for the police, whether it is for the doctors, for any other professions. You can say, you please eat this thing, otherwise you can become sick. But don't say that you will get an injection, big injection, doctor uncle will put your injection, or doctor auntie. So that is a phenomena I think that we have to avoid. So viewers, I am sure today's program is very enlightening, because this phenomena and syndrome we should understand and try to avoid the anxiety which generally happens. Thank you very much. And today's program is live telecasted by V4 News, Caru News, V4 Stream, Malnadu TV India, News Gaon se, Samvad Sarokar News, Bharat Post News, this View Live TV, Gyan, as well as was shown live on Facebook and YouTube. And in our endeavor to bring to you every day new topic, tomorrow our topic is affordability of education in India. And our panelists are Professor Dr. Sudhir Saran. He is the former visiting professor IIM Lucknow and University of Texas at Dallas. He is the senior director of Don Bosco Group, Bangalore, and is the founder of Dr. Saran Consultancy, California, USA. Dr. Raj Lakshmi, head of management department, United University, Prayagraj. Ms. Shalini Malwar, director, Shanti Niketan World School, Aligarh. Ms. Neeraj Mathuria is the head of primary school, Bath, Mathura. So please tune in tomorrow for media conference Lal Goel at 10:30 am. Thank you very much, Dr. Dilip Singhvi. Thank you very much, Dr. Nikita Pawar. Thank you very much, Dr. Caru Maheshwari. And thank you very much, Ms. Karishma Chhatrapati, for enlightening all of us. And I'm sure that today's program is so much enlightening that it will go in a big way, and the viewers will be definitely benefited by today's program. Thank you very much.